Patients I had recently, one this week in Dublin who had a meningioma resected with a craniotomy, and one in Melbourne a year ago. Both patients needed 6 mils unilaterally in the temporal area. When 3 mils was injected, then you're halfway back up off the periosteum. And in both cases, I had to stop, take off the needle, put in a larger needle, and go back into the periosteum. Would you recommend that? Because I couldn't see any other way of doing it to remain safe.
So to do a multiple bolus on the periosteum, that's what you said?
Well, as soon as you put in 3 mils, your needle pulls back up. So you're halfway up and you're back in a danger zone.
Yes.
Okay, because we normally only use maybe 2 mils, maybe 3 mils, but if you're putting 6 mils in that area, suddenly your needle isn't in a safe zone any longer. So what I did was just stop, take off the needle, put in a bigger one, and go back to the periosteum to fill in the extra 3 mils. I haven't seen anything in the literature, but I assume that's the only safe way of doing it.
Yes, I think for me, I never inject more than 2 millimeters on the periosteum. After, it's difficult to spread Elance. I don't know if it was hyaluronic acid or Elance. I mean, if you put more than 2 millimeters of Elance on the periosteum, you won't be able to put more. And as you said, the problem is that the risk is to have compression. And if you don't have cross compression, the product is going to spread in the lower part. So I've never been confronted to this situation, but I would not recommend to inject more than 2 millimeters of Elance. With hyaluronic acid, as you said, maybe it's possible, and maybe to use a bigger needle is possible, but the risk is the vessel injury.
You have to be very cautious with the amounts, always. And actually, I think the norm will be 1 per site. And we have 1 minute, Patrick. I'm going to ask you a question. Sure. Just in 1 minute, what is your preferred technique for the temple using HA, and why?
Okay. So we obviously have 3 different techniques. One is superficial, and the other 2 are gunshot. So you can use gunshot in the upper temporal area or the lower. I give credit to my colleague from Canada, Arthur Swift, who introduced, I think, all of us to the upper gunshot technique. It's very easy, but in my mind, it needs 2 people to do it. One is obviously 1 centimeter over, 1 centimeter down to the sort of lateral area. When you go in there, obviously, the filler can't migrate superiorly beyond the temporal crest, but it can go into the hairline. So if you got your colleague, maybe the nurse is working with you to block there, it can only fill the temporal area, and it's not going to go down into the jawline. And as Frank says, most people only need 1 mil, maybe 2 mils. So those 2 patients that needed 6 mils were highly unusual. One was post-surgery, and the other was an Asian patient that gave me on purpose because they knew it was very difficult.
Yeah. Thank you. Thank you very, very much.